Hey, good evening, good evening, good evening. How are we today? How are we doing? Welcome to another edition of FHF Support Network. Hi, Moyosola. Thank you for joining us. How are you doing? How's your day been? Hello, Dr. Moji. Oh, wow, you're early. Thank you for joining early. I'm just going to wait for more people to join in before I bring you on, except you want to come and talk to me before we can have chit-chat about other things, if you want. Good evening, everyone. Thank you and welcome to this edition of FHF Support Network. And we've been talking about menopause and all things around menopause for a while now. And today is the last discussion in the series of menopause. And so really, actually I'm gonna just post the music and we're having more people come now so I can add the doctor in. So today is the last of the series of menopause, and except we get hi, hello everybody, thank you for joining. Thank you, Moyo, for joining. Like I was saying, today we're talking about menopause and our general health, and we'll be speaking to a general health practitioner, Ekno. Thank you for joining. How are you today? Sorry about that. So hi Romke, thank you for joining. I'm gonna actually we have a number of people now. We can just get started. Dr. Moji, can you request to be added? Bear with me. I have no request. I'm gonna add Dr. Moji. She's joined. Thank you. I've just added the doctor. Hopefully she'll come on now. So this edition, we're just rounding up to talk about menopause and general health. We've had to deal with menopause and lifestyle. We talked about menopause from a gynecologist point of view, from a lifestyle and wellness coach point of view. And today we want to talk to a GP, a general practitioner, and get their point of view. Why is your camera blurry, Dr. Adegbite?
Is it?
Yes.
Is it blurry?
Yeah.
It's still blurry.
Mm-hmm.
I'm not sure why.
Get the techie people. Don't worry, it's okay. We understand because every doctor who's come to this chat has had technical issues. So we have.
I have no clue why it's blurry.
Understand. I'm hoping more people can join us. Really. Apparently, it could be internet issues.
Yeah, I think my internet here is not the best. Yeah,
Right,
I think that might.
Anyway, so it was a bit better now. Let's just crack on. So I was.
But at least you can hear me. You can hear me clearly.
Hopefully, everyone else can. Please let us know if you can hear the doctor and myself. And I'm going to go through some of the questions that we have for the doctor. But I was generally just recapping on some of the things that we talked about, around menopause and the symptoms. And by the way, anyone who's your first time here, give us a thumbs up. If it's your first time joining our chat and being part of FHF Support Network, you're welcome. Let us know how we've done after this chat. But basically, we're all about wellness. We're all about looking out for women. We're a support group that encourages conversation and proper solutions concerning predominant women health issues, you know, from fibroid, endometriosis, myomectomy, people going through hysterectomy. We have a WhatsApp group where we share our experiences. We talk about peer-to-peer kind of support, you know, just helping each other. And also we're big on talking about alternative treatments and using food, as medicine, and you know, and just generally helping each other around lifestyle, you know. It's a platform where women can come and share their experiences without feeling any kind of shame at all, and get support, get advice from professionals like Dr. Adebite, you know, and just where we can educate each other, because, you know, some of the things that I personally had to go through in my journey of my issue was with fibroid, and some of the things that I've learned in the last, I don't know, 6-7 months, if I'd known that in my younger age, my earlier years, you know, I wouldn't have had the outcome that I had to have, you know. So this is why we have this platform, just creating awareness really, and helping each other as women and providing support network. So with me today, I have Dr. Moji Adebute, who is a general practitioner. Please introduce yourself, Dr. Adebute.
My name is Moji Adebute. Thanks to all of those who have joined. I'm a GP. I work in Essex, and have been working as a GP now for, goodness, I sound so old. I don't want to say it.
I sound so old. It's okay.
Yeah, for 21 years, 22 years now. No, not quite 22 yet. 21, going on 22. Goodness,
same.
goodness.
Same.
Yes. So, yeah.
Thank you. And we in the last few series, we just talk about actually we started, I think, in the Women International Month to start to talk about menopause, because menopause is a big thing now, and a lot of people just trying to get the support and the help, you know. And it was in one of our series that we found out actually that there's a free clinic in Bedfordshire. Well, that's if you're in England, and if you're in that part of England where you can get that free help. But most of the time, apparently, that people have to go private, or if you don't get good GPs that kind of signpost you or give you the support, which one of the questions we're going to ask you today, Dr. Adebute. But first of all, let's shoot into it. The first thing I'd like to ask you this evening is what health conditions are associated? Some of these things that we're going to be saying today, I know will be a recap for people who've been, you know, in the previous ones, you know, but honestly, the more that we hear, I guess the more it will stay with us, you know. And I'm big on, you know, really, my well-being is my responsibility, and honestly, the more that I hear, the more I hear people talk about you, or I join in conversation, then that stays with me. So don't mind if you heard some of the things we're going to say today again, but at least hopefully that will help you. That will help home these points in to help someone get the help that they need, or reach out to the right support. So I was going to ask that what health conditions are associated with menopause predominantly? What should women look out for?
Okay, well, I mean, menopause, I mean, those of us who might have been joined the series before now, I'm sure we're almost all experts now. We've heard a lot about the menopause. But menopause, the symptoms most women will probably describe could be lots of things. But there's some that are obviously more than others. So symptoms of the menopause can range from, you know, the hot flushes, which are the common things that we hear, you know, the aches and pains, joint pains, to, you know, urine symptoms.
What
women
symptoms?
have.
Say that again?
Urinary symptoms, bladder symptoms.
Okay.
So sometimes women come or will present to their GP, they're having symptoms of what sounds like a water infection week in, week out. It's not an infection, it's the
Wow.
menopause. Yeah.
Really?
Oh,
Interesting.
yes. Oh, yes. Sometimes it's even bladder weakness sometimes. So, some women may begin to leak, during the
And that's
menopause.
from menopause, not because they've had other
Yes.
accident or they've had to do other things,
No,
maybe
no,
surgery. Really?
no, no.
Mm.
Because obviously estrogen, which is what we start to lose as we hit the menopause, affects
Mm-hmm.
all of those organs, the bladder, the pelvis. So in some women, they'll have weakness, and that can cause some of these symptoms. So those are things to, if a woman is going back and forth to the GP,
Mm-hmm.
with I have an infection, urine infection, that's something to think about.
Oh, so it could be due to menopause.
Yeah.
So because
It
when they
could
go
be.
to the GP and the GP says, "Oh, I can't see any infection and all of that," or will they
Yes,
find the infection?
exactly.
So the GP will say there's no infection, so it has to be other
So
things.
if they've been treated, there's no infection, or they've been checked, no infection, and they keep having the
Mm-hmm.
symptoms, then it's time to think, well, this could be.
Mm. I know.
I
I
think
know. Go on.
Yeah, I was going to say, I think one of the challenges with the menopause for many women is when they will initially present to their GP, many of the symptoms will be thought to be something else.
Mm.
So you mentioned, conditions that are associated with it. So depression, for example, mood problems, anxiety.
Mm-hmm.
So that's why many women end up on antidepressants or anti-anxiety medications,
Mm.
because, yeah, these are sort of typical signs of those other conditions. But yes, it may again be the menopause.
Mm. Mm.
So yeah, it's about, when you present to your GP, having an open discussion about all the possibilities
Mm. Yeah,
around the
yeah,
symptom.
yeah. I agree with that. And
Mm.
that brings me to a conversation we had the last time with the wellness coach around having a
Mm.
checklist, and which we said we're going to
Yeah.
post. Once she shares it with us, we're going to post it to the WhatsApp platform and our YouTube online channels, anyway, social media, so people can, have a checklist, because sometimes some of those things apparently maybe by the time you're even going to your GP, if you live in this part of England where NHS sometimes
Mm.
your appointment is long before the appointment time,
Yeah.
you're already feeling something else and you've forgotten about that other one. So
Yeah.
maybe like have a checklist of those things, so you can even know that, okay, by the time you're going to your GP, like, oh, these are the things that I've experienced, so that there's a kind of a record of what you're
Yeah.
going through or you've been through that brings you to this point where you can get help to be decided if it's perimenopause or
Absolutely.
menopause and all of that. So definitely that checklist we'll be sharing
It's important.
on our platforms. Absolutely, absolutely. I know, and even if you don't have a checklist, like I will always say, as a woman, our wellness is our responsibility. So we ourselves, even if you have a journal, just put something down, because
Mm-hmm.
for me sometimes when I'm feeling the thing, once it goes, I've forgotten. But by the time you go to
Yeah.
the GP, you don't remember to tell them about that one. So it's just whatever it is that's prevalent at that time. So have a little
Yeah.
journal where you can keep these records, and by the time you're going to see someone who can help you,
Mm.
they can have a holistic picture,
Yeah.
of what the issue might be. Thank you for that. Another question that I wanted to ask you today is around um, tell us, I know we talked about the symptoms now. What, as women, what serious adverse effect does menopause have on women?
Okay, I probably won't say serious adverse effect, but obviously it can have implications for women.
Mm-hmm.
One which is obvious is, where the diagnosis isn't correct, and then the woman is channeled down like a wild goose chase, essentially,
Mm-hmm.
when actually, so that can be detrimental, because many women suffer for many years because the diagnosis just isn't made.
No one's told them.
Yeah, no one's picked up on it. So you can imagine a woman who's had these urine symptoms, sometimes for months, for weeks, for years. She's gone to the urologist. She's been here, there, and everywhere. We've treated, water infections, and it's just not going. So, many women become depressed, become low, not because that's their predominant symptom, but because they're dealing with issues that just don't have a solution. So in that sense, that can be a problem. And you find, many women have lost jobs. That's a negative consequence of menopause, because their symptoms are so severe. Employers don't understand. You're not coming into work. I'm really sorry. We can't cope with this. But thankfully, there's more discussion around this now. So employers are. Yeah, people are more aware. But these are some of the things. Now, but having said that, in terms of the physical things, when we hit the menopause, you start to get things like, thinning of the bones, which we call osteoporosis. Yeah, that can lead to, fractures from, very minor trauma. So, these are some of the things that women can suffer because of it. Relationship breakdown, on a more social level, relationships can break down because she's irritable, she's suffering, no libido, so there's so many things. A woman leaking, that's horrible. She's in her 40s, she's in her 50s, at the prime of her life. That's it's really horrible. So these are some of the consequences. Heart disease, this is a time that many women may be diagnosed with high blood pressure, for example, because these have implications on, our heart and blood vessels. So it's just about, when you get to the menopause, I suppose it's time to just look at your general health as a whole,
What from your perspective, what will you advise women? I know we're having a lot of conversations around this right now, creating the awareness and all of that. And I can't say it enough. Our wellness is our responsibility. But what would you say to women? What would you advise women, to look out for, to be, what should they be concerned about? Also, what's the highlights to say, okay, I need to check this out to see if is this perimenopausal or is menopause that I've come to. What should they look out for? What should women look out for, generally, so that they can quickly ask for help?
I think, it's menopause is a very sort of individual journey. So, two women will not be the same. So it's essentially, it's just being brave enough. I think I'll use that word, brave enough to ask questions.
Right.
Now, because a lot of women might feel, I'm getting older, I'll just cope with it. You don't have to cope with it.
That's right.
Yeah, many years ago, we had to cope with these things, but, no longer so. The help is out there. So if a woman, of a certain age, or in your late 40s, early 50s, you find your periods are going haywire, you're bleeding heavily, irregularly, it's don't accept it as it's what it is. I have to cope with it. No, that's usually is the first sign of the menopause hitting. And for some women, the bleeding might be really bad and need intervention. So
could say that again.
So there's medication that can help. So these are things that should be flagged up. So if a woman, in her perimenopause, which could be, usually from 45, starts feeling these symptoms, whether it's mood symptoms, you've never had anxiety or depression, you start to feel these things. You've never had, some women, it might even just be palpitations. they're feeling their heart racing all
Wow.
of the
And
time.
all of that is just symptoms of
That
perimenopause.
could, yeah, that could be the
Wow.
menopause. Having said that, the reason why it's good to
Mm.
present early enough is, for example, if a woman has palpitations, the first thing your GP will think is, well, is this a heart problem, a thyroid problem, or is this the perimenopause? So the first thing you will probably have to have done is test to make sure that there's no heart
So
problem, there's
elimination.
no
Okay.
thyroid problem. Yeah. And then once all of that is out of the mix, and then
Right.
I was reading an article about Oprah, incidentally, Oprah Winfrey.
Okay.
Oprah Winfrey, she said her menopause, her predominant symptom were palpitations.
Mm-hmm.
And she ended up, going, obviously, she has the money to see the best, cardiologists, which is what she did.
Mm-hmm.
Had various investigations done, had a heart monitor fitted, had all of these checks done, and nothing was happening. They couldn't find anything.
Wow.
And she said she was walking through, I think, a hotel lobby or somewhere anyway, and she saw this book, on the menopause, and it was like a light bulb just went on, that this is what I've been suffering all of these years,
Suffering. Mm-hmm.
seeing all these people, and they haven't been able to find the problem. So any symptom that we
Mm-hmm.
have that you just can't explain it. You're in your 40s, 50s. Have menopause at the back of your mind. I'm not saying by
Right.
any chance that every symptom will be menopause. Absolutely not, because there'll be women who will be diagnosed with other things at that
Mm-hmm.
time. But obviously, if you're investigated, nothing found, then you can be safely managed as
Other
having
things.
menopausal symptoms.
Mm-hmm. Mm-hmm. Mm-hmm.
Yeah,
Wow. Wow, thank you for that, Dr. Moji.
yeah,
It's interesting. You talked about palpitation, and I sometimes I used to get that, and I thought, it can't be because I've had some health condition, and I thought, it can't be
yeah,
perimenopause. I'm all right. I'm just fine. And I used to
yeah,
have that a lot. I started a new
yeah,
role, and I'm thinking, what's wrong with me? Am I all right?
yeah,
Why? This is something I've always done. Okay, maybe a bit different, a different environment, a different company,
yeah,
but and
hmm,
I started thinking, and sometimes that makes you feel less than competent. You're thinking,
yeah,
am I all right? And these are the
yeah.
things that women need to look out for and be speaking to somebody. Honestly, sometimes it doesn't even have to be a medical doctor. Just being able to talk to
No,
someone else to say, oh,
yeah,
this is what I'm feeling, and I find it odd. And you never know what someone else
mm,
knows. You never know who they've been talking
yeah,
to. And that's how we just get help.
yeah,
But we need to be
yeah,
talking. We need to speak up, because we come from this culture and this background where everybody's don't say nothing, suffer in silence. We can't. We need to be able to speak out, and that's how the help comes. If we don't talk
yeah,
about these things, you don't know what the other woman is going through.
yeah,
And sometimes this is what we say on even on our platform, because women share their experiences there. And then the other
mm,
woman doesn't have to go through all of the horrible things that other person went through, because
yeah,
there's someone who's there to be able to support, say, oh, this is what I did that helped. This is what you could do,
yeah,
check with
yeah,
your carer, or check with whoever's looking after you and sometimes it's also even about being able to be in an area or in a conversation, in a room where, or forum or online room where there's conversation around these things going. And even as doctors, as gynecologists, no one knows everything. So when
no,
you have other kind of information, you can go and ask your doctor or your GP, and like, oh, what do you think about this? And that can help kind
absolutely.
of their memory as well, to say, oh yeah, maybe I didn't actually consider that.
Mm,
Maybe you should look at that. So
yeah,
um,
exactly.
let's be talking about these things. Let's be helping each
Yeah,
other. Honestly, it's really
mm,
important. It's really important.
it is. It is. And sometimes, when you go to the doctor, because there's that time pressure. Sometimes you've noticed maybe 5 different things. I think that's where what Tony was saying about having sort of, writing something down,
Mm-hmm.
because sometimes your doctor, because of time constraint, might pick up one symptom out of your many, But sometimes if they look at all of them together, it makes the picture clearer. So when you go, don't be fobbed off, don't be fobbed off, to say, look, you've come for one thing, discuss one thing. You can say, look,
That
listen,
only happens with the
think,
NHS, isn't it?
well, it depends. If the people are going to see a GP on the NHS, that might happen. But, if you're seeing private people, you have like an hour to consult,
They're paying your money. You can't.
Exactly. So, so they'll take their time. So, it's important. If you have to write things down to take in, please do it,
No,
whatever it is.
absolutely.
If you have to go for a second appointment, please do it. It's just, being bold enough to say, look, this is what I'm experiencing actually. And like Tony said, you can say, look, what do you think? This is what I'm thinking. What do you think? And they might say, well, yes, it is a possibility, but let's make sure we've ruled out, anything else that could explain
And
these
together you're
symptoms.
exploring this for the solution, really.
Yeah. Yeah.
Absolutely. Absolutely. And we just need to be talking honestly. I'm not saying talk to
We
everyone
need to
and
be
anyone,
talking.
but
Yeah.
find someone who you can talk to about these things. And honestly, it helps.
Yeah.
It helps. And it helps
It does.
before things get worse, before it's too late to be able to get the right kind of help. Thank you, Dr. Moji. It's amazing. And if anyone has any question, please, while I'm talking to Dr. Moji, please put it in the chat, and then we can ask her while we're all here. So I'm going to go to the next question, which might be a bit sensitive, Dr. Moji, because we've had this conversation with a gynecologist, and the kind of feedback, some of the feedback was that, GPs will not help you. They will just not send you to where you can get your menopause plan help. They just fob you off and all of that. So you, as a general practitioner in the United Kingdom, Dr. Moji, please help us. From your perspective, how are you helping the older patients that you have, the women with menopause plan? Because it's really key to start to sensitize people around these things, and people need to have a plan.
Yeah.
So, I mean, I've been told it's not, well, I haven't gone to my GP anyway, but I've been told that it's not a common practice that you get help fast. Someone was very passionate about it. I remember very well that your GP will just ask you there's nothing wrong, you're fine. So how do you help? How do you help to get this menopause plan in place? If you're already doing, or if you haven't started, what's the plan to do that?
I mean, there was a lot of controversy around HRT for many years, up until, recently, where there's, people are more open about it, there's more knowledge about it, there's safer, medications available now. So please don't tar every GP with the same brush. Yes, there might be the GP that is not, as confident
Got you.
to manage menopause.
Right.
Most GPs will probably not manage the more complicated patient. Meaning, for example, maybe a woman that's had breast cancer in the past, she has other, medical problems, epilepsy, those kind of patients. Yes, probably your GP will probably refer on to a gynecologist to manage.
Right.
But most women with, straightforward menopause, no complicated sort of associated medical problems, usually your GP should be able to help. Particularly now where there's more information around the menopause and HRT. But having said that, menopause and HRT is a discussion, an open discussion to have, because HRT is not for everyone. It's not safe for every woman. So not everyone with menopausal symptoms will be able to use HRT sometimes for, medical or health reasons. So, it's a discussion to have about, what are my options? And no, it's not commonplace.
Right.
Even now. And I'll probably say even privately, even at, when you're seeing a private practitioner, it's probably not common to have a menopause plan, because a menopause plan really should be something you do proactively. It's something you do proactively to say, look, I'm coming up to this age. This is my background. These are, my health issues. These are the medications I'm on. This is my family history. What is likely to be good for me, that kind of thing. So that is where women should start to look at.
And
now,
so
obviously,
be confident to speak to your GP about that, to say, I lack a plan because of
yes,
yeah,
yes,
okay,
exactly.
okay.
So it might be that, yes, even from the onset, your GP might be able to look and say, oh, okay, there's a family history here of breast cancer, you have migraine headaches, you have this condition, right? I don't think this will suit you. Or, well, so that is where you do it proactively, so that we don't wait till women are burdened with the symptoms, or as early as possible, when women have the symptoms, that is the time to do the plan and have the discussion. But we're finding now that at this point, women would have suffered for some time before they come, they come forward for treatment. So there's not that proactive approach. But it's getting better, it's getting better because, the awareness is there. In fact, in the last few weeks, a lot of the HRT is no longer available.
Wow.
Because they just can't meet the demand.
Oh, wow.
Oh, yes. Oh, yes. So many people are on it now. So we're having to switch people on certain things because it's just not available.
Right.
So I think with the more open discussion now, having a plan will become more commonplace.
Common. Okay. Amazing. That's excellent. Thank you so much for that. But I was just about to ask a question and that's gone out of my head. Yeah, let's ask the next written question and then hopefully that will come back to me. No, it's come back now. So I was going to ask, so at what point, so the analysis for knowing if HRT is suitable or not, is that the help like you get from your GP, or how does that work? Because it's one thing, because also being African women, we've heard a lot of about HRT. Like, I don't want that thing. It's okay.
Yeah.
So at what point, where's the analysis done to say, okay, yes, you can have it, or no, you can't have it? At what point is that you get that analysis done for the prescription to say, okay, you can go or you can go and have it? And then my other question, anyway, answer this one first, and then I'll tell you what the other one I was thinking about.
Okay. So so the initial analysis depends on who you're seeing, and obviously depends on where you are. For places where women have easy access to a gynecologist, it might be that that's their first port of call to discuss the menopause and how to manage it. So in which case, and if it's here in the UK, it will probably be your general practitioner first, or maybe a specialist nurse or someone that you're seeing first.
It can be a nurse as well.
It can be a nurse. There's some specialist nurses. There's some specialist GPs, who that is what they do. They just run these clinics. It could be the gynecologist. So what they'll probably do at that point is, what are your symptoms? Now, once the woman has described her symptoms, then they will then go on to, and like I say, at that point, they then make a decision based on the symptoms to say, look, right, based on your symptoms, clearly, this is menopause, Or it might be a case of, especially when it comes to probably heart-related symptoms, they will probably err on the side of caution to say, look, let's investigate first
Okay.
before we jump into this. Now, let's assume all of that is out. Then that decision can be made there that, well, looking at your symptoms, your past history, the medication you're on, you're suitable for HRT, or no. So if someone, for example, has had a blood clot in their legs or their lungs, HRT will be a no-no.
Right, right.
So that's where it's very individual that, you can't say, my friend Mrs. A is on HRT, I'll have it.
Well.
Not necessarily. So if a woman has had breast cancer, for example, sometimes they look at the type of breast cancer the woman has had. If it's not one that's sort of estrogen sensitive, then
Right.
they're likely to be able to have it. But if it is, then obviously at that point, it will probably be advised that HRT is not advisable. However, if it appears to be the only option for her, then it will now be, obviously, if it's the GP, they will then refer on to the specialist involving the breast surgeons as well to say, look, this is the situation here. What do we, offer this woman? So that's where it can become a bit tricky, that for some women, it might not be advisable, particularly these kind of conditions. Or if you have a woman whose blood pressure is not well controlled, very high, for that woman, she shouldn't be on HRT till she has. So one of the things they'll do, initially is, make sure they've checked your blood pressure.
Okay.
That's okay, those kind of things, just to make sure it's safe. So if a woman has symptoms and has these conditions, then they'll probably be asking you to think about alternatives.
Yeah. So
to
what
HRT.
other alternatives are there?
So depending on the symptoms, so for example, if a woman has, like hot flushes are the main symptoms, and she's unable to take HRT, sometimes there are other, it's usually used for blood pressure management, but called clonidine, but they can use it for hot flushes.
Right.
Sometimes if it's sort of, dryness down below or itching down below, usually the topical HRT, the one you put on the skin as a cream or in the vagina, that can be used. It's not, it doesn't carry as much risk as, tablets, using tablets of HRT. So that can be used. So it will depend on the symptoms. HRT is always the most effective for these, for menopausal symptoms.
Yeah.
But if it's not safe,
So my understanding is that with the HRT, you can cover more. I mean, correct me if I'm wrong. With HRT, maybe you can cover more because it's hormonal replacement, and that way it's helping most of the symptoms because
exactly
targeted at the hormone replacement. But unlike when if it's a no-no, you're only treating that particular symptom.
Exactly, absolutely. Exactly.
Right.
So if people have now some, those with depression or even the palpitations, there's some other, antidepressants that can sometimes be tried, but they're never as effective as, but, sometimes these are the alternatives. So which is where, what Buki told us about is important because, looking at your lifestyle, your diet, the
kind of food
your well-being. So that's in addition will sort of help.
Amazing, awesome. Thank you so much, Dr. Moji. Quickly then, also, can you I know we talked about this previously, but help us with a recap on how to tell if you're in perimenopause or you are already in the main thing.
In the menopause. So the perimenopause is peri, so the period around becoming actually menopausal.
And are the symptoms similar or different?
Symptoms are similar. Symptoms are similar. It's just that for many women, they may not really recognize it to start with. So they're still having periods, but they may start to have hot flushes. They may start to have mood swings, brain fog where, they can't concentrate. They may start to have aches and pains. But so they may still, or their periods just start to become irregular. Now, you are menopausal when your periods have stopped for 1 year, 12 months.
1 year.
Yeah. So at that point, you are, menopausal. But before that, some women will go 3 months, they've not had a period, then bang, it comes back again. So all of that is being perimenopausal. But 1 year, no periods, that's being menopausal.
Okay, thank you for that. And it doesn't matter, age doesn't matter, because you can find someone who's in their 50s, mid-50s, and they say they haven't got any symptom, and they're still having their periods, actually. And you can find someone in their 40s, mid-40s, and they're having menopause, and you're thinking,
exactly.
I mean, now what's the problem?
Exactly. Yeah. Or unfortunately, if you have a woman in her 30s that has had to have her ovaries taken out for, for whatever reason, if she's had cancer of the ovary, for example, or she had huge cysts that needed to be, removed. So, she's in her 30s, but she will be menopausal because, the ovaries have been removed. So, yeah, it is possible to get even the, younger women, but generally, the natural menopause, probably later on.
So 12 months of no period is confirmation.
12 months, no periods.
You are in menopause, Another thing that I learned, from one of this series is, because it used to be my thinking that after a while, you're no longer menopausal. But apparently it's not so. It's just that your symptoms change to something else. And so this is forever after now as well, until Jesus comes home or he returns.
The joys of womanhood. But the upside is, you don't have to deal with these periods anymore. You don't have to.
I was having a conversation with someone about this today. So it's now being able to wait, because I was saying to her, look, sometimes, maybe not the kind of period I had because they were too heavy, but she's in her mid-50s and she's still seeing her period and it's regular and everything is fine. And I'm thinking, and she said, so I said to her, you know what, enjoy this business. You don't have all these peri symptoms and all of that. Make good of it, but so it's now, trying to find a balance, like, really, do I really want the period, or I should just stay away from this period and be going on with this perimenopausal thing? But I don't know. So I said maybe she just enjoy having her period until it comes, because that's another how many years of her life that she's going to be going through all these many symptoms,
I know.
It's amazing. It's interesting. It's interesting. Our time is fast spent. I'm going to ask you one more question, and I'm trying to see if anyone on the platform's got anything they'd like to ask Dr. Moji. Please put it out there. Let us know. I know you've talked about on this a bit, but I would also still want to put it out there. How can we effectively manage this period of our life as women? This menopause, big issue as women. How do we effectively manage it? Because sometimes, like we said, and it's in sometimes the little things that can make women feel depressed, feel incompetent, feel, in your view as a general practitioner, how can we effectively manage it and just stay on top of things? We know that life has changed forever, but
I mean, like I said in the beginning, when we, start getting to, that period, that time of our lives, late 40s. It's time to just take stock of your health in general. While it's good to, think about the menopause, it's also time, because you're getting older, essentially, that's what it means. You're getting older. We don't like to hear it, But yeah, essentially you're getting older, and it will probably mean that you're more at risk of other conditions anyway. So be it, hypertension, be it diabetes, be it arthritis, heart problems. The older we get, the higher the risk. So it's time to take stock of that in general. And the way to manage sort of menopause and your general health is, I think, being proactive. I think that's where the well-being and lifestyle aspect comes.
Right.
Yeah. Medication is all well and good, but if you can take proactive steps to prevent going on to medication to treat these things, then the better. So, for example, it's the time it would be advisable to have routine blood tests, for example, do routine blood checks,
So
blood pressure
so
check.
is this a yearly kind of MOT thing that women will have to do, or how often do you recommend that we do all of these
Not
tests?
necessarily. I think it depends. Not necessarily yearly, but currently when we hit 40, you'll be called in for a sort of health check. Some people will respond, some won't. And the reason it happens is because we know that, as people, hit that age, then, things may begin to decline, not necessarily. And if you have a health check at 40, nothing is found, it's all good. You don't necessarily need to have these checks every year.
Right.
Obviously, if something flags up, then yes, a yearly check is good. Every couple of years, for example, every 3 years is fine.
Okay.
Blood pressure, it's now, these things are now self-management. You buy a blood pressure machine.
Absolutely.
Previously it was made to look like, only the doctors know how to do these things. It's not a big deal. In fact, we encourage people to do it themselves now. Don't come to the surgery to do it, because it will probably go up. Yeah, it will probably go up while you're there waiting for, to come in and see the GP, and you're thinking, what are they going to come up with today? So we encourage people to have a monitor. You can check it. We don't do it every day. Don't even do it every week. It's not necessary, but at least it's there. You can once a month, every 3 months, you can check. So those are the kind of things, exercise. Buki talked a lot about it, for those of us that were there. And if you weren't there, sort of just lifestyle changes, your diet, exercise,
so
those things.
on our Instagram page.
So yeah, if you can watch it's really good. Because yes, your body isn't processing food like it used to as you get older. So you may have to cut back on the things you used to do. It's not processing cholesterol as well as it should. So one of the things your blood test will check is your cholesterol level, because those things contribute to high blood pressure, heart disease. And, particularly, if you have a diet, culturally, a diet that's high in fat, this is the time to start cutting back. So those are the things that women should do really to try. And those things help with menopausal symptoms, to be honest. Exercise, mindfulness, they all help. So you may find that, yes, a woman doing that may not need HRT. She may still do, but, that way she may not necessarily. And, this menopause we're talking about, some women don't even know what we're talking about because they don't have any symptoms.
Yeah.
They don't have any symptoms.
I was talking to someone today, and she's in her 50s, and she said, I don't have symptoms. I'm like, are you sure? Maybe you should take notes.
No. So yeah, they sail through it without knowing, and then some people are at the severe end of the spectrum. So it's just that being proactive. That's I think that's the way we can sort of look at these things. We know more about it now, and yes, it's like I say, it's not going to be for everyone. But once you can have the discussion about what you can do, and and sometimes you may just decide, look, okay, maybe I'll try this first. if it's still not working, then I'll go on to HRT, which is absolutely fine.
Absolutely. Thank you so much, Dr. Moji. And I do agree about the
No problem.
lifestyle change, honestly. And
Yeah.
I mean, I'll share a little bit of my experience. Sometimes, because as African and young people, we eat a lot of rice.
Yeah.
And sometimes when
Mm.
I do stay away from eating rice, sometimes I try to say, okay, let's not eat rice for 2 weeks or 3 weeks, you know.
Yeah.
And I can literally tell the difference.
The
And if I
difference.
eat
Yeah.
rice maybe once after that, I can tell the difference. All of a sudden,
Yeah.
you know, my body feels
Yeah.
heavy and all of that. So
Yeah.
it's really
Yeah.
about being proactive and
Yeah.
lifestyle changes, and whatever is not going to help eliminate,
Yeah.
reduce, you know, and
Reduce. Mm-hmm.
you know, and
Mm-hmm.
find alternatives.
Change.
All of a sudden, I like
Change.
quinoa. Quinoa can do anything. Quinoa,
Yes. Yeah.
quinoa is nice with vegetables. Quinoa is nice with chicken. You know, so just finding alternatives, honestly,
Yeah.
to stay
Snacking on
healthy,
different
to stay.
things, healthy snacking if you must.
And
Yeah.
it was you who told me about making quinoa into amala. I was like,
Oh yeah. Yeah.
okay. You know, so just about finding alternatives, really,
Yeah.
honestly, and so we can
Yeah.
stay well, we can stay alive, and
Yeah.
be
That's
the
right. That's
be the
right.
best that God has created us to be. Thank you so
That's
much,
right.
Dr. Moji. I
No problem at all.
absolutely
Thank
appreciate
you.
your time. Thank you,
Thanks for
everyone.
having me.
Thank you, everyone, for joining us tonight. And please, so today is the last series in the menopausal one, but we still continue in the next 2 weeks. We're going to be talking about one of the other women's health issues. Let us know what you would want us to talk about. You know, any feminine health issues. That's why we're here, to find the professionals like Dr. Moji who can come and talk to us and help us, give us information, educate us, you know, around all of these feminine health issues. Yeah. So thank you so much, everyone, for joining us. You can follow us on
Thank
Instagram
you.
at feminine health underscore fibroid support. And if you want to see some of the chats we've had, you know, previously, they're all there. You can listen to them. And if there's anything else, thanks a whole lot, Doctor. Someone saying thank you to
Thank you.
you.
Oh, thank
um,
you.
you know,
Thank
and
you.
so if there's anything else you would like to hear or talk about, or if we just need a support system, honestly, that's why we're here. I mean, we don't say we know everything or anything, but we just find the help. Find someone who might, or someone who knows somebody who might be able to help you. And that's what
Mm-hmm.
this is all about, honestly, just helping each other
Absolutely.
as women, educating each other, supporting each other, how we can live the best life that God created us to live, because as women, He created us special. So yeah, thank you, everyone, for joining us this
Thank you.
evening. It's been an absolute pleasure. Dr. Mdu, thank you for coming. I know you will be back
Thank
again.
you.
You haven't got much choice. Eh? If it's my bully, you can drag me any which way.
I know you will drag me back somehow.
Thank you so much. I do appreciate your time. Thank you.
No
Absolutely. And thank you,
problem.
everyone, for coming. I hope this has been helpful. I hope you've had a bit of information or something that can get you, you know, thinking and be proactive about some of the decisions you're going to be taking, to just reach
Yeah.
out and get the help and support that you need. Have a lovely evening, everyone. Oh, someone's just joined. Sorry,
Thank
we just
you.
finished.
All right.
You can listen to the recap of this on our Instagram page. Thank you, everyone. Oh, thank you,
Thank you
Shekinah.
all.
Thank you for joining. Thank you very much. Thank you, everyone. Thank you, Oyema. Thank you, S. Wilson. Thank you, Pegs. Thank you, Moyo Sola Oluwasi. Thank you, Ekno. Thank you very much. Oluwayemisi, thank you. And Oyema, thank you. Shekinah, Trust Ventures, thank you. Rosalind, Ame, thank you. Popola Buki, thank you for joining us. Official Lola Mark, thank you for joining us. CMN Wilson, thank you. We appreciate the Ageless Queen. God bless you. Thank you for joining. Evie, thank you. Thank you, sir. Yeah. Trying to just look through the list. Anyone who have missed, sorry about it. But thank you everyone for joining. We'll see you again in 2 weeks.
See
And we'd
you
like to
again
hear from
soon.
you what you want us to talk about in the next chat with a professional. Have a lovely evening. God bless.
Thank you. Bye.
Thank you everyone. Thank you. Bye-bye.